All right, I'm Dr. Wells, Stewart here with a patient who's 2 weeks status post-knee replacement done via muscle-sparing Subvastus approach with Mako. And you wouldn't show off your motion there. So she's fully straight, holding her quad up by herself, and then how bent can you go? And then I think they had you at like 117 in therapy today, so 2 weeks after surgery. How long were you on a cane or a walker after surgery?
I have been on a walker probably just the first week. It's more for show than it is for anything else.
Nice.
It wasn't really, I mean, it's there if I needed it, but it's really wasn't doing anything.
Yeah.
I mean, I was just walking on my own and, doing what I needed to do.
And what are you taking for pain at most points?
Most of my pain medicine has been over-the-counter meds. We have done some oxy. The first couple days after surgery, we were on a pretty regimented schedule for that. My daughter's a nurse, so we did it that way. And then we started spanning it out. And so now it's just at night, or if I do a lot of riding or exercising around.
That's perfect. So again, 2 weeks, no cane or walker, 0 to 117. This kind of shows the power of a muscle-sparing Subvastus approach combined with Mako robotics.